Today, we're going to talk about how to start solids in your infant. And this is something that I really enjoy talking about. I usually bring it up at the 6-month checkup. So a lot of fun to talk about. So a little bit about me. I am a board certified pediatrician. I'm usually at the Sammamish office, and I've been with Allegro since 2016. Prior to working at Allegro, I lived in the East Coast, so I was in a private practice in the Washington, D.C. area before my family and I decided we would move to a new area and start fresh. I do have two teenage girls who enjoy eating, and we had a lot of fun starting solids when they were infants, and we still continue to enjoy cooking and baking. I do dancing, I do ballet, and I like to get outside whenever I get a chance. So, you have your newborn infant. During the first 6 months, you're either breastfeeding and or introducing formula, and this provides all of the essential nutrients that they need during that first 6 months. So they are all set, and then once you hit 6 months, then you start to see signs that they are ready for solid food. And historically, solid foods were started way earlier, even in the 1970s when I was born. Sometimes solid foods were even started in the hospital at the newborn period, starting to give some rice cereal and a spoon. And so since then, over the years, things have evolved. And now our goal is to wait until your baby is ready and showing signs that they want to eat and that they want to be an active participant in this new activity. And so we'll talk about what to look for. So in the very beginning, your baby's born with a tongue extrusion or tongue thrust reflex. And that means that whenever you put something in the mouth, their tongue automatically pushes it back out. And so over the first couple of months, that reflex eventually disappears. And so that usually is gone by 3 or 4 months. And that's one sign that your baby is able or ready to accept food into the mouth. Another thing that I commonly get asked about is, what about teeth? They have no teeth, how are they going to eat? But the teeth are not necessary. The gums are very strong, so the gums will mash down the food. And so you are able to start food even if they have no teeth. A lot of babies, or some babies actually don't get teeth till 12 months or beyond. So not to worry if your baby has no signs of any teeth popping through yet. They are still okay to start solids. Some of the milestones that you want to notice in your baby before they start solids would be, are they able to sit up and have some head control and upper torso control? Are they starting to be more upright? And that's a good sign that the gross motor milestones are getting there. The other thing you want them to be ready to do is to be able to put things in their mouth. So are you noticing that they are picking things up like toys, putting them in their mouth? Is everything ending up in their mouth? And that's a good sign that they have the fine motor skills to start eating. And then finally, are they showing some curiosity? So if you're eating around them, are they staring at you? Are they looking at you with their mouth open? Sometimes they start moving their mouth like they're imitating you eating. And so this curiosity is important too, because you want them to want to eat. And so you want to look for that. And for most babies, these signs show up around 6 months, and it can vary, especially if you have a premature baby. You may have to wait a little bit longer. You really want to listen to their cues and wait till they are really wanting to eat and ready to eat. So now your baby's ready, showing some signs. And so how do you start? So you want to set the stage for success. And so you want to have them either in a high chair or baby chair, or even in your lap is fine. They should be sitting upright. You don't want them in like a reclined position and feeding them that way. You want them to be sitting up so they can participate, they can touch the food, grab the food, play with it. So have them in a comfortable position. And you want to start usually early in the day. So if you're starting a new food, you want to start maybe for her first half of the day to make sure that they're not having any allergic reaction. And you don't want to start something, say dinner time, because then you put them to bed and you can't observe any new rashes or reactions to food. So start early in the day And for most babies, that's also a time when they're, less cranky, they're in a good mood. So you want to avoid times of the day when they're super hungry or in their cranky mood or fussy mood. So you want them to be nice and calm and ready to try this new food or try this new experience. And finally, eating together as a family. Eating should be a fun thing for the baby and for you. It's something that you do together. And so you want them to watch you eat and observe. So you should be eating as well during this interaction. Everybody should be eating together. And finally, just wanted to say that I encourage you to try to turn off all your screens, TVs, iPads during this time. Eating should be mindful. And so try not to use iPad as a distraction. A lot of parents think, I'm just going to turn on this show so that the baby can be distracted and then I can get the food in them. And so that's not the goal when you're feeding a baby. You want them to learn how to eat, play with the food, try to figure out what happens when you put the food in the mouth and how to swallow and how fast to eat. So turn off all screens during the mealtime, make it interactive as a family, make it fun. So now that it's time to eat, you'll start with a single ingredient food, such as some bananas or avocado, something nice and simple that you have in your household. And you want to start slow with a single ingredient so that you can tell if they have a reaction, what that reaction is. And then at first, it's going to be very small amounts, even small, like a couple teaspoons of food, because they really are trying to figure out what to do with this food. Once they get it in the mouth, how to use their tongue, how to use their gums, and then how to swallow. So eating's complicated when you haven't done it before. So just small amounts, let them figure it out and be patient. And it's going to get messy. You want them to feel the food and play with it. There's going to be a lot of mushing the food, a lot of reactions from their tasting new foods. So give it time, but let them figure it out and let them explore. So as far as picking out the first foods that you want to start, there really is no right or wrong way. So some of the easy things that you have around the house, that'd be probably the first thing to choose, something that your family typically eats that you already have in the house. If you want to do some bananas, steamed carrots, squash, pumpkins, avocados, but there really is no limitations. And you can start fruits or vegetables or proteins. It doesn't really matter. And historically, used to be rice cereal or baby oatmeal. Those would be the first things to start because it's iron rich. And you would mix those with breast milk or formula, but you don't have to start that, but it's an option. And then for babies who are breastfed, it's important to start iron-rich foods early because you want to help replenish those iron stores. And examples of those would be like lentils or leafy greens, meat, if that's something that your family eats. So go ahead and start those foods. But in general, there's no going wrong. You just start the food, let them figure out how to eat it. So you're going to have small pieces of whatever food you're introducing, and it's nice and soft and small. That way they can pick it up. If you're doing, for instance, if you're doing baby-led weaning, you're just going to place the food on the tray, on the table, and let them go for it. Let them figure out what to do next, how to pick it up, get the food in their mouth, and then be patient. And let's talk about some of the foods that you want to avoid at this age. No honey, and that's not until 1 year. And reason for that is because rarely honey can have botulinum spores, which can cause botulism. So try to avoid honey until after age 1. Next thing would be cow's milk. Cow's milk is hard to digest. It's hard on the stomach. So no cow's milk until 1 year as well. Although if you wanted to do some yogurt, some cheese, those are fine to introduce. So let them go for that. Juice, we encourage you to hold off on juice as long as possible. There's no nutritional value in juice. So right now, just water if you were to introduce something to drink. And then let's talk about choking hazards. So large pieces of food can block the airway. So certain foods you want to avoid at this age would be whole grapes or whole nuts, hot dogs, raw, hard vegetables, popcorn. All these foods you want to hold off until they're age 3 or 4. And something to consider would be, if you haven't done so already, CPR class for infants. That way you know what to happen if they happen to choke or gag on their food. So now's a good time to start drinking from a cup. And that could be a sippy cup, straw sippy, straw cup, or even an open cup. And at this time, you would just put water. And it can be tap water or whatever water your family drinks is safe to drink that you can put in their cup for them. And at first, your baby may not take to it. They may throw it. They may not really do anything with it. So be patient. Eventually, they'll figure it out. And keep in mind that at this age, they really don't need much water because they're still getting their breast milk, their formula. So whatever they drink is great. And if they're not drinking much yet, that's totally fine too. And then keep in mind as we head towards summertime that if it's hot out, offer water, let them drink as much as they want. They'll figure out their water requirements. Let's talk about some of the common allergens. So for instance, peanuts, tree nuts, eggs, shellfish, these are the common allergens. And the research shows that starting allergenic foods early can help prevent allergies. So you do want to go ahead and start these foods along with the other foods that you're starting at this age. So there's no reason to hold off. And some of the ways that you can feed these foods would be like a nut butter or peanut butter. You can give scrambled eggs. And when you're feeding eggs, it's fine to give the yolk and the white. So the whole egg is fine to eat. So go for it. There's no reason to hold back. And then recently, there's been some of the ready-made allergen introduction kits that you can buy, at the store, at Target. And those are fine. It's fine to use if you want to have some structured way to introduce those foods, but they're not necessary. You can just give food that you already have in your kitchen, in your pantry. So then as you continue to feed your baby's starting to figure out how to eat and enjoying all these foods. You're going to continue with your breast milk and your vitamin D if you're also breastfeeding, or your formula. So that will kind of continue. And as far as the amounts, it may stay about the same or even drop a little bit in volume. So not to worry. But right now, the goal, you're starting to introduce more foods. Your goal by 12 months would be that the food will be primary source of nutrients while the milk would be secondary. So you're kind of heading in that direction, something to keep in mind as you progress. And so once you've introduced a lot of new foods, you can start to combine the foods. And for instance, like dumplings or pasta dish, sandwiches, start to put foods together if they're not having any reactions. Spices, babies can have for sure. A lot of parents are concerned that the baby can't handle spices. And so, especially if baby's been breastfed, they probably already introduced to some of these spices. So definitely make the foods tasty, let them have spices. There's no reason to hold back with that. And then at first, you'll probably be feeding just once a day. Baby's just learning how to eat. But as the baby's starting to try more foods and get more interested, you can introduce, lunch, dinner, do more meals, and kind of imitate the meal times that you and I would have sitting together as a family. So they can eat 3 meals a day, just like you and I. And then also introducing utensils at some point. The babies are observing you eating with forks and spoons. So let them have their version of the baby fork and spoon so they can play with it, handle it, see if they can figure out how to eat with it. For the most part, it is much easier to eat with your hands and your fingers. So they're still going to be eating with their hands and fingers for a long time before they really figure out, the fine motor skills to use a utensil to get the food in their mouth. And that's usually around 15 months. So introduce the utensils early, but don't expect them to be using them anytime soon. So what to expect as you go on this journey. And I really do want you to think about teaching baby how to eat as a journey. There's going to be highs and lows. Appetites are going to vary. So you might have a good breakfast the one day, and next day they may not really be hungry for breakfast and eat a big dinner. So expect that things will change day to day, and just kind of listen to your baby, let them guide you. And then on the other hand, preferences may also vary. They may like blueberries the first day. The next day they may hate it. So no pressure, just keep offering it. Let them have, let them see the food, be around the food so that they're exposed to it. And then they may take to it later on. So keep exposing your child to these new foods. And then the stools, you may notice as you introduce more foods that the poop is going to change. What you commonly see is that the poop is less frequent. They're not pooping several times a day anymore. And then it's going to be more firm, so less watery, especially for breastfed babies. It's not going to have the loose consistency anymore. It's going to firm up. You might even see chunks of food in the poop. So like undigested pieces of carrots or corn, things like that. And that's quite normal, nothing to worry about. Some parents get concerned that there's a problem with digestion or malabsorption, and that's not the case. Baby's still learning how to mash down on these foods. So you're going to see chunks of food every once in a while. So that's just part of the learning process. Now that we've kind of talked about the mechanics of how to start solids, let's talk about how to develop healthy eating habits for life. And so this is from a book called Child of Mine, Feeding with Love and Good Sense by the author Ellen Satter. And she is a nutritionist who has been around for many years. I think she started writing her book in the 70s, and it's been revised over time several times. And what she talks about, and the main gist of her book, is the division of responsibility. And what that means is that as a parent, you're responsible for what is on the table and when the feeding time is and where that occurs. And so that's your job. For the baby, they're responsible for whether they're going to eat or not eat, and how much to eat. And so essentially what she's saying is that it's not the parent's responsibility to get the child to eat. You want your child to listen to their cues and hunger cues of fullness and figure out how to eat, how much to eat, how fast to eat. So they have to learn how to do that over time. And so your child knows how to eat and how to grow. It's an instinct. And so be patient, let them figure it out. And there's shouldn't be any pressure during meal times for them to eat a bite of food or certain foods. And by doing this, you're letting them take responsibility for their own eating. And that will help in their future eating and having good eating habits and learning to eat different foods, different types of foods. And so the feeding process should be fun, should be rewarding for both the parent and the child. So just keep in mind, it's not about the bite. You're not trying to force this one piece of broccoli into your child's mouth. You want to kind of look at the big picture that over time, they're going to learn how to eat. And your goal is to provide the structure and the opportunities to learn how to eat. And then they will develop those skills so they can learn to like different foods. And try not to label, a meal or day as a good day or a bad eating day. Try not to label your child as picky or a bad eater or a good eater. You want to maintain a positive attitude about feeding. Because if you're stressed about it or if you're getting frustrated about it, they're going to feel it and they're going to be stressed as well. And just kind of thinking about the whole process. You want to derive some pleasure from this, and you want your child to find eating to be pleasurable. So kind of keep that in mind, make it stress-free, just enjoy the time eating together. Then here are the resources that I commonly recommend. The book that I just mentioned from before, Child of Mine by Ellen Satter. That one you should be able to find at the library. And that's a great resource. It's very comprehensive. And there's lots of information from newborn to older kid age. And then the other book, Food Fights, it's more contemporary book, certainly more recently, and it is published by the AAP, but follows the same principles as Child O' Mine. So they're both great books, great resources if you want to learn a little bit more about how to feed your infant into childhood and teenage years. So in conclusion, so when your babies are starting to get older, closer to 5-6 months, start to look for those cues. And then when you feel like they're really ready and they're showing signs that they're ready, go ahead and start those solids. And then after you progress through that journey, you want to listen to your baby as far as when to introduce more foods, larger amounts of foods, more meals, follow their lead, and they'll kind of guide you. Some babies will be faster in progressing to new foods. Some babies take it slow and might not take to it at first and take a little bit more time to get there. So, everybody's a little bit different. And then finally, eat as a family. It should be an enjoyable experience, stress-free. It should be a fun interaction for everybody involved. And then I also encourage you to involve your baby and your infant and your child in the process of getting food. At the store, let them look at the apples and feel the tomatoes, or if you're at the farmer's market, look around with your baby. And then when you're home cooking, have them be a part of that experience too, whether it's mixing and having them help mix pancake batter, or if you're putting together a dish, let them do parts of it that they're able to do at their developmental age, so that they can feel like that they're part of this process. And the more that they are able to participate, the more interest they'll have in eating these foods later on, as they get older and have a varied diet and eat lots of food. All right. Well, I wanted to thank you for your time. This is a topic that I really enjoy talking about during my checkups with the babies. And I think parents also are excited usually at this time too, to talk about starting foods, because they want to introduce foods to their baby and enjoy that experience with them too. So this is a picture of my teenagers who clearly like to eat, and especially now that they can drive places and take me to their favorite restaurants. So it's a fun thing and lifelong experience. So let's open it up to questions.
Yeah, awesome. Thank you so much. I love their ramen shirts. All right, so our first question here is it okay to start with sweet foods, like more fruits or sweet potatoes, or should you try starting with the less sweet foods like vegetables?
Yes. So historically, people would say start with the less sweet foods, start with the vegetables so they don't get used to the sweet foods. But there's no evidence showing that happens. So go for it with the sweet foods, the fruits. There really is no right or wrong order. So don't think too hard. Fruits are totally fine to start as a first food.
Great, thanks. Our next question is, how will I know that my baby's ready to transition from just one solid food a day to more foods?
Yeah, if you've introduced 1 or 2 foods and they're doing just fine, then you could try chunkier foods if you feel like they're having no issues with the texture. So after a couple times of each new food, you can keep going and just keep going with types of food and the consistency, the harder, chunkier foods, and just kind of listen to your baby. If they're having some issues with the chunkier foods, then slow down, kind of listen to them, and stay a little bit longer with the softer foods.
Okay. Our next question here is about kind of the schedule of your day when you're starting solids with your baby. So, if should you give them a bottle right before you try and feed them their solids, or right after, or should you try and space those out, or what should the kind of schedule look like?
Yeah, so it's a little bit tricky because most babies are still taking the bottle or breastfeeding every several hours. So you want your baby to still be hungry for mealtime. So don't do the bottle right before the solids, but do kind of separate it in time so that they do have some hunger and they want to eat when it's come mealtime.
Great. Do you have any tips for peanut butter for introducing peanut butter to kids since it's kind of thick and sticky? People are wondering if that's kind of hazardous to eat alone or what they should mix it with.
Yeah, so there's a couple ways. You can do a thin smear of peanut butter on some bread. So like you would make a sandwich, you could do that. Or if the peanut butter is mixed into like a muffin or a baked good, then that's fine too. So as long as it's not super thick and where it might clog the airway, and just kind of stick to a thin layer, start with that. That'd be fine.
Perfect. How about spicy foods? Can we give our baby spicy foods?
Yeah, there's no reason not to. So maybe start slow just to make sure they like it and they're into spicy food. But if they're loving it, there's no reason not to. And just kind of, they can have pretty much whatever you're having as far as spices and even super spicy stuff. It's fine.
Awesome. And then it looks like probably our last question here is going to be about quantity of food. So can you give your baby too much of solid foods in this beginning? And should you be slowly increasing how much you're giving them over time, or what would you recommend?
So naturally, it's going to be a slow start. They're just trying to figure out how to eat. So at first, a couple teaspoons, and if they're done, then leave it like that. If it seems like they want more food and they're hungry and they're loving whatever your food you're giving them, then by all means go for it. Let them have more food because they can self-regulate and they'll stop eating when they're no longer interested and no longer hungry. So there's no need to limit the amount of food. So let them eat and let them have different types of food during the meal. If they want your food, if they're staring at your meal, let them have that by all means. So let them eat.